Unless the current trend is reversed, our country will see a growing ethnic and racial disconnect between those who receive care and those who provide care.
The problem with our healthcare system, one of the many problems with our healthcare system, is a lack of diversity in our physician workforce.
A minority patient is more likely to come see you as a minority physician and receive care from you. They're going to be more involved in the plan of care. They're going to be more likely to take the prescriptions that you prescribe. There's going to be a better dialogue going on between you and the patient. So there's something that's called unconscious bias, and people don't realize that they make decisions based on other factors other than the medicine and other than the facts.
It's important when you're looking at a patient to have some understanding of what about that patient's personality, what about their cultural influences, what about their ethnicity affects their health, because all of those are what we call determinants of health.
There was a study that was done by a physician named Dr. Schulman at a physicians conference. He did an analysis of what providers would do when presented with specific patients. And the patients were an elderly white male, an elderly white female, an elderly black male, and elderly black female. And they all came in with the same condition, and they all had a pretty straightforward direction as to how they should be treated. And what they saw was that the elderly black female was less likely to receive the appropriate interventions that the elderly white male received.
Having a diversified workforce, admittedly, is not going to affect every patient. It's not going to be the solution for every problem. It's not going to fix all disparities. But there is definitely data that's been shown in multiple studies that shows that some patients appreciate their minority providers better. They feel that they communicate with them better. They feel that they trust them better.
Healthcare is not a privilege. It is an absolute human right. And so whatever your color, whatever your ethnicity, whatever your socioeconomic background, you deserve the best care possible.